Kami persilakan Ketua Eksekutif KARS untuk membuka acara ini, Kak.
Assalamualaikum warahmatullahi wabarakatuh.
Salam.
Good evening, ladies and gentlemen. Distinguished guest, Professor Dr. Pa Chung Wang, Chairman of the Asia Society for Quality in Healthcare, College, and attendees. It is both an honor and a pleasure to open today's webinar on the use of artificial intelligence in healthcare, Taiwan's experiences. This event marked an extraordinary opportunity to explore how healthcare can be reimagined and enhanced through technological innovation, particularly artificial intelligence. Allow me to first extend my deep respect and admiration to Professor Dr. Pa Chun Wang for his unwavering dedication to advancing healthcare quality across Asia. Professor Dr. Pa Chun Wang's expertise and leadership in this field continue to inspire and guide healthcare communities, and we are incredibly fortunate to have him share Taiwan's remarkable stride in AI integration within healthcare. Taiwan has become a pioneer in harnessing AI potential to drive forward health outcomes, patient care, and operational efficiency. The innovative use of artificial intelligence in Taiwan is not only a testament to the nation's commitment to excellence, but also serves as a powerful model of what can be achieved when cutting-edge technology meet the highest standard of healthcare. Here in Indonesia, we are on parallel journey seeking to integrate more AI-driven solution into our healthcare system. Today's session presents us with a valuable insight and practical application that could guide and inspire our own development. I'm certain that Professor Dr. Pa Chung Wang experience and expertise will be of immense value to all of us as we work to enhance our healthcare system for the benefit of our patients and communities. Let us seize this opportunity to learn, exchange ideas, and perhaps most importantly, be inspired by Taiwan's success and forward-thinking approach. Thank you once again to Professor Dr. Pa Chung Wang and to all participants for joining us in this journey toward an AI-empowered future in healthcare. I wish you all a productive and insightful session. Thank you very much.
Terima kasih. Thank you very much, Dr. Stoto. Let us start with the presentation. Pak Indra, please put the curriculum vitae of Professor Pa Chun Wang. Ya, jadi Prof. Pa Chun Wang adalah tokoh yang sangat sentral, pernah menjadi ketua ASQA dan juga pernah di board member dari ISQA. Jadi orang yang sangat aktif dan sangat ini. Dulu beliau pernah bicara sekali pada waktu awal COVID untuk menjelaskan bagaimana penanganan COVID di Taiwan. Sekarang kita akan mulai. Teman-teman sekalian, nanti Prof. Pa akan menjawab pertanyaan-pertanyaan. Silakan yang menyimak presentasinya Dan buatlah pertanyaan, nanti ada waktu untuk translate ya. Jadi untuk tanya, nanti bisa banyak yang tanya untuk melatih. Ya, kami persilakan slide diputar.
Wang from Taiwan. I'm now the Vice in Superintendent at the Cathay General Hospital and Chair Professor at the Fujian Catholic University School of Medicine, and also the Board Executive of Joint Commission Taiwan. I have been the CEO of Joint Commission Taiwan for 7 years before I finish my term. I'm very happy to have this chance to share some of our knowledge and experience about the smart healthcare in Taiwan. As you know, the smart healthcare, which means the use of IT technology in the healthcare services, has been an emerging field in health industry, especially in quality and safety. I personally have worked in the hospital quality improvement and patient safety for nearly 20 years. Years after years, I feel that when you want to improve the quality of healthcare, to the end of an improvement campaign, you need a IT system to stabilize your process, to facilitate the efficiency of the services. So it's inevitable with the development of the IT technology, we are getting used to more and more IT technology into our daily healthcare services. So we can use the information technology to computate the big data, to improve the digital imaging and also the telemedicine, especially during the pandemic. And although most hospitals are gradually adopt the electronic medical records, and lately, like in 2 or 3 years, the artificial intelligence has been introduced into the healthcare industry. We want to deliver more efficient, personalized, and convenient care using technology into a dynamic ecosystem. So the IT can help us to manage people, to manage the information, to manage the material. That means the logistic support of the healthcare service. And we will have more needs and options in using the smart healthcare technology. So many market surveys have forecast that there will be an increasing demand of the smart healthcare in the market. So the digitization has transformed the healthcare industry. The rising adoption of so-called mobile health, the government initiative to digitize healthcare, and the change of the population structure, which is the increase of the prevalence of chronic disorder. We will need the IT system to help us to manage the chronic disease. So let's talk about the AI is the topic of today. So how do we apply the AI into the healthcare? Because we are not familiar with this new computation technology. So when talk about the low risk administrative processes, AI has been useful to help with the coding, scheduling, and the operation efficiency improvement reliability. And in the clinical area, so the AI can help us to improve the services, to improve the outcomes of the patient care. But when the AI used in the healthcare industry, we have to think about the new ethical issues, because AI someday it will be smarter than human brain. So sometimes they will do something crazy that out of our control. device. That means the notebook, the computer, the mobile phone, so on. So it is very early for the Taiwan's healthcare industry to adopt the smart technology into our healthcare. And so for 7 to 8 years, Joint Commission of Taiwan has noticed this development, this trend. So we have the QCC campaign every year. Before we call it the HQIC, Healthcare Quality Improvement Campaign. Now we changed the name to the National Healthcare Quality Award. So in this NHQA award, we add the smart hospital category in the award. That means we want to encourage the teams that use the smart healthcare solution to improve the healthcare quality. And the smart healthcare is the main role in the quality improvement. So the category has been very, very popular. So as you can see that we have the smart solution. That means they use the IT to solve some clinical problems, to use smart health technology to improve their care services. So if they collect enough certificate from comprehensive outpatient care, inpatient care, emergency care, surgical care, paramedical care, administration, then the hospital will be awarded so-called smart hospital. So far, we have 15 large hospitals in Taiwan that have been awarded the so-called smart hospital certificate in Taiwan by Joint Commission of Taiwan. That means those hospitals, they comprehensively adopt the IT technology into their healthcare services. So far, Joint Commission Taiwan have awarded more than 500 certificates of solutions to the hospitals in Taiwan. So you can see the number of these 5 years, because 24 awards competition is still going on. We will not award the hospitals until early January. The whole campaign will finish at the end of this year. So we can see the data of the past 5 years. In total, we can see the number of the smart healthcare. We will have around 100 something, hospitals every year. Most of them, are from the inpatient care and education. We see a great increase of participants numbers. And you see the content of the smart healthcare. As I mentioned previously, smart healthcare can divide into different categories. You can use telemedicine, you can use AI, you can use decision support, you can use VR. But you see more and more hospitals adopt the AI prediction into the smart healthcare competition. Just in 2024, you see so many AI projects originated from the hospital to participate in the outpatient care, inpatient care, community care, education, environmental, and administration. But when AI development by the hospital, they have to consider many things. So this is a big map. I'm sorry, this is in Chinese, but basically, if you have idea, you have a creativity, the AI can be applied to all fields in the healthcare. But when you use the AI in hospital, use the AI in healthcare, you have to consider the responsibility of the system. You have to consider the transparency of the data, to consider the availability of this algorithm, and to consider the resilience ability of the system, and very important, the accuracy of the system. But although you have to consider the negative side, you have to secure the safety of the AI use, and you have to secure the security of the IT, and you have to protect the privacy of patients. It is particularly very important because when you use the AI and you have many vendors to help you, so you inevitably you need to upload your data to the cloud because the computation engine is in the cloud. So under these circumstances, patient privacy will be a big concern. And although when the AI do the computation and output some data, how's the explainability of this output? And when the AI, out of your control, how do you control the AI to work within the territory you want them to work? Although when you use AI, you use a large database. So at this point, you have to consider the threat in the data set or embedded algorithm. Sometimes it is very difficult to identify the potential threat and the risk in using AI. Okay, so below I will continue to explain to you some of the AI projects in Taiwan. I have done the background explanations to you about the AI use in healthcare because this is a very new field. I believe that everybody in the industry around the globe, they are thinking, we have this technology, but how can we apply this technology into our daily practice? So here I want to share with you some examples in Taiwan. These are the awarded projects by Taiwan's hospital, and they publicize their outcomes in using AI to improve the healthcare. So the first part, AI can be used to improve the clinical processes. So let's see. Right now, a very powerful tool called the large language model in medicine. That means the machine can understand your language. So not just to type what you say, but also to respond to your request. So if you have the iPhone, so you have the Siri embedded in your iPhone, so you can use your iPhone. Where is a coffee shop nearby? Then it will show you by identifying your location. So same thing with the LLM in healthcare. So in this photo, you can see this is an article published by NEJM. So you can, how do I summarize the patient's history? And how do we choose the treatment plan? And they can also answer your question. And although it can help you to search into the electronic health records. So it is very, very powerful tool. So for the medical profession, it can help us with the clinical documentation, creating discharge summaries, generating clinical notes, and also can help with insurance authorizations, summarize research papers, and the radiation interpretation, suggest treatment options, and design the treatment plan, and help us with the diagnostic assistance, and help us with the medical triage. And for patients, they can help patients to understand the laboratory results, to help the patient to understand the disease, and help the patient to understand the physician's note, and it can personalize a patient's health recommendation, and to help the patient to predict their health risk, and also to assess their symptoms and analyze their well-being, and to evaluate their mental status, and to check if they adhere to the medication schedules for the chronic disease patients. And although it can provide the rehabilitation guidance. So how about the projects in Taiwan? So this is a project developed by the China Medical University located in Taichung. So they are very proud. They developed a system called the IMAMS. That means they can use artificial intelligence to predict and to suggest the bacteriology of the patients. They have this antibodies projects, and also have the stroke detection project, knee joint MRI, bone age, and nursing voice recognition systems. I will introduce you later. So the IAMS, to optimize the antibodies treatment, the system can integrate the cultural information in the EHR, and predicting if the patient will develop the sepsis or not. And by doing this, to suggest the physician to use correct antimicrobial agent, and to enforce the physician to do the timely intervention and improve the patient prognosis. So this is very, very powerful system that can search the bacteria, background bacteria data in their hospital's health information system. So the AI can do the risk predictions, and can predict the chance of the patient to develop the sepsis and its mortality, and also to predict the antimicrobial resistance. So it will suggest physician through a personalized antibiogram to advise the physician to prescribe correct antibiotics for the patients. They can learn and mass spectrometry signals to improve their diagnosis power. So they can accumulate data from historical laboratory data, and also from other patients, and to accumulate all this data into a very smart suggestion. So the suggestion can be used for these patients. So they can predict a very malicious bacteria like the MRSA, like the CRKP, or colistin resistance. Okay, so we can also use the application of self-trained generative AI in the healthcare field. So when we look into the largest hospital chain, which is the Chang'an Memorial Hospital chain, they have a very, very big hospital system that incorporates more than 10 big hospitals around Taiwan. So their hospital system can take maybe 10% of Taiwan's national health insurance budget every year. So since their hospital chain are very big, so their hospital very big, and also their IT system are very big. So they can use the big data to do a lot of computation work. So it's very, very busy hospital. So they want to use the LLM to make them do the documentation, and to help them to generate the laboratory report, test report, so they can largely decrease the workload of the human being. And although in Taiwan, most of the big hospitals, they joined the program called D2B. That means if they want to pass the accreditation of the critical care, they need to have the ability to conduct door-to-balloons within 90 minutes of arrival into the hospital. And they need to do the RTPA or the IA for patient with stroke. So that's mandate in the accreditations of the critical care hospitals. So it is very critical to shorten the pre-hospital time of the patients. So if the patients can have the cardiogram, the chest pain patient, if they can have the EKG in the ambulance and transmit the data back to the ER and also to the on-duty cardiovascular doctors at home, that will greatly reduce the D2B time, because from our experience, the D2B project, the EKG time is very critical, is a bottleneck for the success of the project. So it is very important to triage all these chest pain patients. So they are thinking a lot of ways to get the EKG data as soon as possible. So when patient can have the EKG in the ambulance, they can transmit the data back to ER and also back to cardiologists. And they have the AI embedded in the computer, so they can help it to analyze if the patient has the ST elevation. That means that the patient may have some AMI. So the team of D2B can prepare in advance. So that will save maybe 10 to 15 minutes. It looks not very long time, but for D2B, it is very critical. If you can pass this bottleneck, it will be very easy to reach the goal of the 90 minutes of door-to-balloon time. And although for the use this technology, not only the EKG data, but also the image of the sonogram, can be transmitted to the telemedicine to a home emergency room. So they can use the remote monitoring in ICU command center to understand the patient is moving to our hospital. So the ICU can prepare in advance. So they will know the problem of the change of the condition of these patients and do preparation in advance. So from this case, this also the China Medical University Hospital, they have many branch hospital around the island. So they can serve the patients 220 kilometers away from their hub hospitals. So they can have a real-time assessment. And in the evening, when the staff are not in the hospital, although they can embed the analyzing algorithm machine, which is in using the AI. So the AI can do the preliminary analysis of the image and tell the on-duty physician what's going on with this patient. Even they can send the image or recommendation to the on-duty staff at home. Same thing. If they can know the patient's condition in advance, they can do some preparation. And although the newborn transfer, so the newborn is very vulnerable. So the big hospital, they often have the network with local clinic or a smaller hospital. So if there's any problem with mom or the baby during the delivery, they can call for help, and the hospital team will move to the clinic to take the baby back to the to the NBC, newborn center of the hub hospital. But you know, the babies, they are very vulnerable. So continual monitoring of this baby during the transportation process is very, very important, because the staff in a newborn center can order to conduct the timely intervention if there's any change of the baby's physiological situation. And although you know that Taiwan have a lot of hemodialysis patients, the rate the renal failure rate is probably highest in the globe. You know, so hemodialysis is a big problem. So government is doing a lot of efforts try to reduce the cost of the hemodialysis, and also try to improve the care of the kidney health. And although they are developing the model, the pilot model called the home hemodialysis model, it is not a peritoneum dialysis, but rather it's a hemodialysis. So they have a hub center to remote monitor all the home hemodialysis area. So they can use continuous physiological monitoring around this area. Then they can send the nurse to visit the patients. So if the patient is young and as a working people, you know, they can still work in the daytime and do the home hemodialysis in the evening. So that will greatly improve the quality of life of these patients, and also to improve the economy of the family. So they are doing the tests to use the telemedicine to continuously monitoring the physiological data of the home hemodialysis patient. Okay, so this is another. So that's although the China Medical University Hospitals project. That hospital is a hospital chain, and although very, very big, located in mid-Taiwan. Then the other hospital is the Taichung Veteran General Hospital. They are although very big, you know, so they have although the heart team, smart heart AI, and although it is to identify AMI early, so they call the Central Taiwan Life 8. So they have 14 file teams. So this hospital work with the file teams in Taichung area that can operate EEG machines and onboard the ambulance. So although they want to identify if there is a ST elevated, so it is qualified for the D2B. So it is very important. So that system, you know, help to reduce the EKG time from interpretation time from 139 seconds to 37.1 seconds. So that's a huge decrease of the EKG interpretation time. So it's a person-enabled health, interoperability, predictive analysis, and the governance and workforce to work with cross-governmental and hospital teams collaboration to integrate the relevant information from various systems. Makes the information flow very smooth and not limited by the system, device, or location. So it will also protect the security of the information.
Indra, selesai.
正在录制此会议。
So let's continue to other project. So to improve the process, you know, so it's very interesting. That also the AI can do some logistic support to improve the emergency congestion that will help to triage the patients based on the priority of the severity of their disease condition. So that can help them to efficiently allocate the medical resources. For example, the physician, the nurse, and the bed, and the space of the emergency room. So they can improve the decision, so they can reduce the readmission or revisits ER. And also, right now in Taiwan, there's a very serious problem, after pandemic, because we are facing a big problem of manpower shortage after pandemic, and the situation is getting worse and worse. And it seems that there's no signs of return of the manpower to their working position. So right now, there's a very important main goal of the healthcare IT and also the AI. That's to reduce the manpower load. For the patients. So they want to try if the GPT, chat GPT can reduce the manpower load to help them to reduce the paperwork load. That means we have the chat GPT. Right now we have the called the healthcare GPT. And they can hands-free copying of the medical records. They can accurately respond to patients' questions, and they can summarize a patient's history, trying to solve the shortage of medical manpower. That the project conducted in Taiwan's Taichung Veteran General Hospital, they have introduced this healthcare GPT project. They claim they have saved 60,000 minutes of the administration times every month. Okay, so mostly widely known use of the AI is the image interpretation. I would say this not just the interpretation, but also the prediction. So many physicians around the globe, they are doing the so-called image project. That means the AI, the algorithm can help to make the image diagnosis of the disease. Like this is a stroke image. That means many stroke, when they happen, is an infection, small infection. When they happen early, you cannot tell even from your naked eye to see whether there is the infection in the brain tissue. So somebody in Taiwan, the Zhanghua Christian Hospital, they developed a project to analyze the stroke image, CT image. So they can do the further analysis to see there is a early or minor stroke. So they can inform the physician to prepare for the RTPA or the IA project. So this is AI for stroke image analysis called iShare. So they can estimate the ischemic volume. They can predict whether there is a stroke happening, ischemic stroke. You know that hemorrhagic is easier to diagnose, but it is not for the stroke case, which happen to be the candidate of the RTPA or IA. And also for the radiation therapy, the auto contouring, the AI can help to precisely contouring the area of radiation that the treatment suspense due to the physical discomfort will be reduced if you can precisely allocate contouring the area of radiation. You don't have to have the extensive radiation exposure, and you can improve the organ protections, you can reduce the mark time. Usually, this is the work of the radiation oncologist, and they will use a lot of time to contour the area of radiation. This is very time-consuming and also is experience-based, but the machine can help. The machine can do a lot of help for them to contour the radiation area. And although the KARS General Hospital, National Taiwan University Hospital, they have worked on the project that's very interesting because colon polyp is a very common findings during the colonoscopy examination. So sometimes it's very difficult for physician to make decision whether to biopsy the lesion they found identified during the endoscopic examination. So the two hospitals, they jointly develop an algorithm and get a patent to preliminary identify the polyp to show physician the risk of being a malignant lesion of this polyp identified during the colonoscopy. Into the real world colonoscopy to help the physician to make the decision whether to do the polypectomy or biopsy for the lesion they have identified. And although the lung cancer, because right now the lung cancer becomes the top of Taiwan's main reason of mortality. So government is pushing very hard for a large-scale screening for the lung cancer because it's very interesting that many lung cancer patients are young female, no smoking history. So the low-dose chest CT is very popular in Taiwan. But by doing all the screen, they have a huge volume of the image case to study. So they want to reduce the loading of the radiologists and also the pathologists. So they are developing many systems that can help to interpret the CT and also the biopsy, histopathology slides. So they can assist the physician to reduce the physician's time to do the diagnosis of the lung carcinoma. So as you can see the ROC curve, from left right corner. So the prediction model has very good sensitivity and the specificity and so far so on. So this is a very feasible project that can embed it into the X-ray reporting system to help pop up the suggestion to the radiologist and the pathologist, so they can make good, quick decision. Okay, so there are other use of the AI in Taiwan. So the so-called precision medicine. So when we talk about the precision medicine, we use to talk about the gene examination. So to identify if you have the gene or not, which is correlated to your response to the target therapy for the malignancy. So government in Taiwan, we are establishing the population database, and although the National Health Insurance is working very hard to work with the NGS because they try to reimburse, to give money to the target therapy for the gene diagnosed cancer patients. So we need the AI to do the gene analysis, so they can provide the gene information to the hospital, to the gene information to the physician. Then the physician can claim for patients from the National Health Insurance. So right now, government is doing the National Biobank Consortium. They are working very closely to establish the normal data for comparison. Then we will collect more and more patients' gene data, so they can use in the future. So it is very important to collect NGS data to provide a more accurate clinical drug treatment. So it's very important to collect the normal data and also to collect the NGS test report from the cancer patients, and also to collect the data of the follow-up data. That means that if we reimburse the medicine, so if the patient respond to the medication, so we will accumulate this data, and our algorithm will be more accurate over time. So the hospital can do that. Hospital can establish their own database, and also they can share with other hospital. Then they can upload the data to the government-operated cloud database. Then this database, if patient permit, they can get a reimbursement from the National Health Insurance, and although they can join the clinical trial, and they can be part of the academic research upon their agreement. So the government is doing that. That the Taiwan's National Health Insurance Ministry, and although the Taiwan's Academy Sinica, they are working on establish the biological database for AI analysis. And by doing so, some big hospital like the National Taiwan University Hospital, they are very big. They are the top research hospital in Taiwan. So they have their own supercomputer. So it's very important for the computer to have a super computation power. So that would need a lot of the energy consumptions, and need to training the natural language project, and to the supercomputer, the performance is much better than before. So they can do the whole genome sequencing in 20 minutes. So that's what happening in Taiwan, National Taiwan University. And although today I will spend some time with the medical education, but not too much, because the LLM model right now can be applied to the medical education although. So they can do some simple medical history taking with the machine, with the robot. So it means when you input the algorithm, AI input into the robot, the robot can pretend they are the standard patients, and they can dialogue with the trainee. That means the medical students or the PGY residents. By doing so, they are training the trainees how to do the history taking work and how to make a diagnosis. So that's the use of AI in this field. Okay, so I think Taiwan is a single payer national health insurance system. So the NHI, National Health Insurance, play a big role in the AI application in industry. So that means if government encourage the use of AI, this will succeed. So as I mentioned before, the NGS reimbursement needs the gene data, and also the prediction to reduce the workload, so on. So the national insurance can help a lot. And although they encourage the identification of the pancreas cancer, and also the lung lesion, and the heart disease prediction model, the classification score, they can predict the happening of the heart disease. And also during the pandemic, the Chengong National Chengong University down south, they developed a system that can interpret the chest X-ray to predict the COVID-19. And although National Taiwan Veteran General Hospital in Taipei, they developed a system that can predict the metastatic brain tumor. And although the Far East Hospital in Taiwan, they developed a system to classify the nasopharyngeal carcinoma, which is a very popular disease among the Fujian, Guangdong, Taiwan people. And although the lung nodule by the Taipei Medical University I just mentioned. Okay, so these are pretty much the start projects in Taiwan. Actually, the AI use in healthcare is like a very, very popular topic. So right now in Taiwan, everybody talk about the AI, and it's a big race. So the hospital, they are compete to each other, try to develop the feasible, usable AI project to help their healthcare services. But all these projects are in their very early stage. So they have participated in the JCT's National Healthcare Quality Award, but they need to have some data. They need to have some publication to show to the world the use of the AI in healthcare, and they have to face the competition from other competitors around the world to prove that their system are better than others. So I believe there are so many AI projects going on around the world in many hospitals. So these are domestic projects from Taiwan. So we hope that they can have a very successful development of their model, of their algorithm, and that they find a niche and develop a very good business model so the AI can be used smoothly in the healthcare industry. Okay, thank you. Thank you very much.
Okay, thank you very much. Prof. Pachunwang, are you there already? Pak Indra? Oh, okay. Prof, your we cannot hear your voice. Is the still closed? Your it's okay, yeah. The it's a very advanced presentation, so you are expert in anything. Expert in anything. Yes, it's very good. Okay, we will start with the question and answer. Please, friends, we have several questions. Pak Sutoto, you want to greet Prof. Pachunwang first?
Yeah. Professor Pachunwang, thank you very much for your excellent and insightful presentation this evening. One question, please. in your experience with artificial intelligence assisted prediction in healthcare, how would you evaluate the accuracy and safety of this AI tool in clinical setting, especially regarding potential risks and limitation? Additionally, what measures are being taken in Taiwan to ensure the reliability and security of AI prediction in patient care?
Mhm. Okay, so can you all hear me? Can you hear me?
Yes, 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 very good.
Okay, thank you. So I would say that the development of AI in Taiwan is only about 2 or 3 years, you know. So right now we are still in its infancy. So we are trying to explore the every possibility. So I don't think the patient would know that they are served by the new AI technology. So I think so we are just at the beginning. Many other possibilities and many other problems, you know, we have not encountered. So I would say that this is just the beginning. Yes.
Okay, thank you very much.
Thank you very much,
Any other
Professor.
questions?
Yes.
No, it's enough.
Okay.
Yeah.
We have many questions for you. Prof,
Okay.
just now about 150, 160, 170 participants. From Dr. Saptaji, how accurate AI can help for the final research result from scale 1 to 10?
I would say, you know, in the laboratory, you know, you can achieve right now. If you want to publish some paper, you know, if your accuracy not exceeds 90% accurate, you know, so your paper will not be published. Okay, but you know, when applied all this AI in the real world, in your everyday clinical practice, that's different things, because the data quality will affect the outcomes of the AI prediction. So that's all depends. So that's one area we need to find out, because right now many papers, as I present in my presentation, many of them are very nice research project, very nice paper, you know. But how about the real use in the daily practice? You know, it's really a question. So, like myself, I myself present a project in American Academy of Otolaryngology. You know, I developed an algorithm to diagnose the otitis media, the infection of the middle ear. So in the lab, you know, our diagnosis accuracy exceeds 95%, you know. But, you know, in the real world, we will miss some problem, you know, with the earwax. Patient have the earwax or the depth or the light of the otoscope. So many conditions that can affect the real AI prediction outcomes. So that's something we need to consider, because the real world is not perfect. It's very different from the laboratory or the controlled study environment. Thank you.
Thank you. Very good answer. This from Dr. Mulyadi Hartono. Data is crucial for AI implementation. How you prepare or manage healthcare data? Thank you.
Excuse me, how to prepare the
Data. I mean,
the data?
who is putting the data, or is it taken from the electronic medical record, or must it
Yes.
something?
Yeah. Okay. So that depends upon the what kind of application you imply to. Okay. So for my own study, you know, I would like to develop the model, the algorithm, you know, in the laboratory. So I tend to create a research project so I can collect the pure data to develop my model. Then, you know, you can use this model to apply to the real world. That's to use a model to retrieve the data from the hospital information system. So that's another source of information. And the third one, like the gene I talked to you in my presentation. So in Taiwan, the government handle a project, a population project, to collect the population gene data. So those people voluntarily donate their blood for gene test. So the government can establish Taiwan's population gene database. So that's another data source. And although Taiwan's national health insurance database is a very huge and valuable database for research and for the AI use, but in the past we have already have thousands of publications, But right now we met some problem, in our parliament, because our parliament legislator, they worry that these data are not authorized by the patient to release. So government right now have a very strict law to control the use or the release of the national health insurance claim data. Okay, so that's the four data sources I can imagine right now in our AI development. Thank you.
Thank you. Next question is nearly the same from Dr. Joko Pratomo, SPOG. So you make a program questioning AI, and AI took you put your e-medical record in the data bank, and then
Yes.
they collected themselves. Yeah, nobody
Yes.
is doing the data.
Yes. Yes.
Typically, yeah. Okay, from Dr. Subroto, Prawiro Harsoyo, after implementing AI in hospital setting in Taiwan for several years, are the cost of service reduced, same or increase comparing before implementing?
Oh, okay, of course. I think so. This is very important because we have been doing the smart healthcare, as I present to you in my presentation, for several years. Okay, at the beginning, it was all an investment. You don't see a much return. It happened. The pandemic occurred. Then we have a manpower shortage. So right now, the government put a goal there. Say when you use a smart hospital, smart technology, you use the AI. So you need to put the KPI, is how to reduce the workload of our staff as the KPI of your program. So we will see the KPI to tell if this is a very successful project. That means that you need to show the effectiveness of your AI project by reducing the staff's workload. So it's very important. Yeah.
Yeah, very good. Now from Ira Astrini Silalahi SKM. Data and information of patients are very important. How do we make sure that security can be maintained?
Yes. Okay. So this is a very sensitive and very, very important issue. So I think right now many vendor outside the hospital, they are trying to sell their product, their AI product. But I can tell you that in Taiwan, no hospital dare to let their hospital data go out of their firewall, the hospital firewall, to the cloud, because the vendor always have their their computation machine, outside the cloud. It's a cloud computation. So right now, the AI use in Taiwan, most of them are within the hospital. That means the hospital, either they develop their own AI algorithm, they use this algorithm within their hospital or within their hospital chain, or they can purchase the AI computation algorithm from outside vendor, but they need to take this algorithm back into their firewall so they can do the computation within their hospital's firewall. So all the data are within their firewall, not going outside. So I think that that's a very important consideration for the hospital right now, because they are very much afraid the leak of the data outside their own control.
Yeah.
Yeah.
Do you think, this is my question, do you
Yeah.
think that in the future, all countries will make their own iCloud to 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 concern for the safety of their data?
Yeah, I think so. I think they will use the Model 2 I just mentioned. They will purchase the computation algorithm, then put in their own hospital's system. They will not let the data go outside their hospital,
So it must be
except
very
for
big.
those. Yeah, except for those you need to report to the government, like the national health insurance data. So the government handling the data for you. So the government is responsible for the security of the data. Otherwise, they will try to keep the data within their own firewall.
But you said that the patient can ask to the AI about themselves. So they know all they can record. So they know everything from the.
Yeah, they know everything, but I mean, we are not to that step. That means the patient can ask the AI, like your iPhone says, what's my problem? I get a test in the hospital. So I go get all these test results. Please, the iPhone, tell me, the Siri, tell me, what's wrong with me? So
Yeah.
when that day comes, the physician's job will be replaced by the AI. So,
Yeah.
but I think we are not there yet. Yeah.
Yeah. So they can use their own AI. Yeah. Okay, from
Yes.
Purwanto, how popular is AI in Taiwan, in
I
healthcare in
think
Taiwan?
I think most of the big hospital they are doing more or less some AI project. And all the big hospitals they feel the peer pressure because their peer hospital are doing the AI. But at the same time, people are thinking how to make the best of AI. So we are in a competitive pathway. So I think that it's just a start. It's not a very popular. It may be very popular in research. Many AI papers, but in the real clinical practice, I think so. We are still in its infancy.
Yeah, thank you. From Nurse Munjari, MM. I am a professional nurse. I like to know how to improve our skill up to master of AI in supporting our nursing service.
So this can be divided to two division. Okay, one is the medical education. So in my slide, I use one slide to show that we can use AI to improve the medical education. That means you can talk to a robot, learning to do the question to ask the patient's history, do this kind of medical education. And the other is to the AI, because I mentioned right now we have big problems with manpower shortage. So we want to use the AI to reduce the nurse workload. So the main focus is to reduce the paperwork. So the large language model, LLM, many hospitals are trying to use the LLM to help the nurse to create nursing records. So they claim that they can reduce the paperwork time by 70%. They can finish the nursing records in 2 or 3 minutes. So that's a huge improvement from previous. But as I said, this is just the beginning, because how correct and how much time you need to spend to edit the generative AI created medical record or nursing record to you. So that will take time to test its validity.
I want to ask you, when we are medical student, it's very difficult to hear the sound of the heart
Yes.
in cardiology. So maybe AI
Yes.
can show me how is the sound for this sickness or something like that. Maybe
Sure, sure, sure. Yes, yes.
students,
So,
yeah.
yeah, because right now in Taiwan, we have a company who developed the electronic stethoscope,
Hmm.
electronic. So right now they can record the the murmur or the breathing sound, and transform into the digital signals.
Hmm.
So with these signals, the AI can help you to differentiate the disease, and also to can help can help the education, and they can transform the digital signals into the image. You can see the heart murmur, you can see the heart sound from the computer screen. So that's a very, very helpful, for AI analysis and also for a medical education.
This really tremendous. From Anindita Basuki, Professor Wang, uh, Professor Pa Chun Wang, yeah. In your experience, which AI have the most accurate result? Because I think the more complex process, so the result will be less accurate.
Yes. So this I think that there's a two determinant. So one is the data size. So if you are handling a very complex problems, so many categorization, very complex classification. So you will need a huge database, very big database. That's the first determinant. And the second determinant is the quality of the data. So you don't want to put a lot of garbage in your data set. If you can clean up your data set before stored it, so you can greatly improve the accuracy of AI prediction. Yes, thank you.
Yes, thank you. This from Dr. Mulyadi Hartono again. In the future, with AI dominate healthcare information, how will be the medical faculty? How the medical faculty should restructure their curriculum?
Yeah, so I think in the future or at the present, it is very important to put a digital capability in the medical curriculum. I mean, the physician or the medical professionals in the future, they need to have the ability, the digital ability, to interpret, to use IT technology and to use the data. So they need to have some capability that we don't have, that we were not educated. So their education program will be very different from our time. Yes,
Thank you.
thank you.
So, anybody wants to ask directly? Raise your hand. And this is a very rare opportunity to have Professor Pachun Wang here. And it's a really honor for us. And you are speaking a very good English, so we understand it clearly. Anybody who wants to raise your hand? If not, Professor, I want to ask you about a little bit about the national health insurance you have there.
Yes, yes.
How much do the lowest class people must pay a year for the insurance?
I think
The poor
it's
people are paid by the government, yeah?
yes, yes.
So the
The poor
lowest
people,
class?
the poorest people are paid by the government. Yes, yeah.
And then the lowest class
And then,
must pay how much
we only have five class of
yeah,
the premium
payment?
of the national labor national health insurance.
Hmm.
So it's based on salary, based
Hmm.
on your salary income.
Hmm.
For example, the physician always have the highest ranking. But
Hmm.
it's above. You are at the highest, but there's no limit, no ceiling, no
Hmm.
ceiling. But you only pay the highest grade. That's all. And the lowest grade, is based on your basic salary. So the
Hmm.
basic salary, essential salary, is regulated by law, by
Hmm.
labor law. So recently the labor law is 30,000 30,000 new Taiwan dollar. It's about 1,000 US dollar, and the premium is 4%. 4%.
4%. So
Yeah, national health insurance.
$25
Yeah,
US dollars.
40. So it's $40, 40 US dollar.
$40 a
Yeah,
month.
yeah, a month. Yeah, that's the lowest. The
The
lowest.
lowest, yeah.
Yeah,
So it's
yeah,
much
the
more.
lowest. Yeah, yeah.
In our country, it's only $3 a
Mm-hmm.
month, the
Mm-hmm.
lowest class, and
Yeah,
our insurance is all covered until
uh,
until oncology and heart surgery also. So
yeah,
very
yeah,
very different, yeah.
yeah. But your pool, your population, your pool is bigger. Our pool
Yes,
is very is
yeah,
small.
yeah,
We have only
so
yeah,
very
we have only 23 million population.
23, yeah. Jakarta is already 40 million.
Yeah.
And maybe how's translation by AI?
Mm-hmm.
So if there are foreigners coming to the hospital, maybe the
Mm-hmm.
robot do it, or they talk and AI can translate.
Not yet, not yet. But we are thinking, so it will be very, very useful, if we have a robot, can talk to the foreigners,
Yeah.
especially we have a lot of Vietnamese, Philippine and the Indonesia helper in Taiwan.
Mm.
They always accompany the senior citizen to
Mm.
visit doctor,
Mm.
so or to hospitalize. So it will be very, very useful if we have the translation robot. They
Mm.
can talk to these people in their mother tongue language. That would be very, very useful. Yeah.
Yes, very good. And do you think with AI, the legitization will be going up because people can
Well,
ask everything and they know if the doctor's doing wrong? Before
yeah,
they
I
don't
think
know, but now they know.
I think so. I mean, the doctor-patient relationships will evolve over time. Because
Mm.
right now, patient can do a lot of homework
Mm.
before going to see you. And
Mm.
if you give them some advice, they want to seek for a second opinion. So that becomes a very, very common practice. And we get used to it, especially like me, we practice in the center of the metropolitan. I mean, our people are more literate. So it's very common. I mean, so that means the physician, the healthcare professional, you need to practice according to the guideline, because your patient may know better than you. Yeah.
Yes. So it's going to change the world.
Yeah.
I think it's very, very late there already. Thank you
Uh,
for your
yeah.
time, Professor. It's a very
Yeah.
opening our mind,
Yes.
and nobody is going to ask again. So if not, we are going to close the session. Uh,
Yeah,
Professor.
so I like to invite you, because December 5th, we will have a very big healthcare exhibition in Taipei. So
Hmm.
I will provide you the meeting information. So if anybody from Indonesia are interested, in attending, you are welcome to attend this meeting. It's very, very interesting, very big meeting every year. Yeah.
Maybe you can send it in the chat so everybody
Okay.
can collect it.
Uh, let me
The
find
meeting
out.
chat, you can post there.
Yeah, post. Can I post later?
Okay, you
Yeah,
can
because
send to
I'm on
me.
this. Yeah,
I will
because I'm on this screen.
give.
Yeah, I give you later. Yeah.
Yeah. Okay. Thank you very much. Okay. So in the name of KARS and in the name of Dr. Sutoto, uh, I uh, I thank you very much for your tremendous knowledge and telling us about something new. So it will open our mind about the use of computers in healthcare. So it's very advanced, and we hope uh, the whole world will be in peace, so we can go further and we can be friends to everybody. Thank you very much. Hope you have all the health, all the happiness, all the success from God, and we have our friendship, uh, friendship greetings from Indonesia to Taiwan. Oke,
Thank you.
Dr. Johnny masih ada? Nggak ada ya. I will close the session by a little prayer in bahasa Indonesia. It's okay ya. S- um, Assalamualaikum warahmatullahi wabarakatuh, teman-teman sekalian. eh, Selesai sudah presentasi dari Profesor Pak Chun Huang, seorang ahli THT dari Taiwan, yang luar biasa sekali karena beliau juga dosen dan beliau juga organisator. Eh, saya akan membawakan doa ini dalam agama Islam, dan yang bukan beragama Islam mungkin dapat menyesuaikan. Bismillahirrahmanirrahim. Alhamdulillahirabbil alamin. Hamdan naimin, hamdan syakirin, hamdan yuafi ni'amahu wa yukafi mazidah. Ya Rabbana lakal hamdu wa lakal syukru kama yang balili jalali wajikal karimi wa atimi sultanik. Ya Rabbana iyyaka na'budu wa iyyaka nasta'in. Hanya kepadamu lah kami bersujud dan hanya kepadamu lah kami memohon, ya Allah. Semoga kau berikan pahala yang tinggi kepada Profesor Pak Chun Wang, dan kau bukakan segala pintu-pintu kecerdasan kami semua agar kami bisa mendapat ide-ide dari pembicaraan ini yang mungkin dapat diterapkan di sekeliling kami, ya Allah. Dan semoga ini sangat penting untuk kemajuan-kemajuan rumah sakit yang ada, ya Allah. Ya Allah, berikanlah kepada KARS selalu inovasi-inovasi yang cemerlang, bukan kami pada segala hal-hal yang dapat memajukan negara dan bangsa ini. Terima kasih atas eh, malam Tolabul Ilmi yang sangat luar biasa ini. Wassalamualaikum warahmatullahi. Thank you, Prof. Wan Chun Wang. Bisa
Thank you. Thank you.
ya.
Good night. Good
Good night.
night.
Maybe we open the camera so you can see everybody. Indra
Okay.
bisa buka semua.